I gave a talk on the role of chemotherapy in metastatic malignant melanoma. I think the fact that it was the only talk on that subject at the conference shows that it's not as popular a topic as it was before. And the question was, with all the advances in the treatment of melanoma, whether there is still a role for chemotherapy in some patients. The major point is that there have been huge advances in the treatment of melanoma over the last 6 years, and these have come from advances in immunotherapy and in targeted therapy. But prior to that, we had spent 20 years trying to advance chemotherapy with little or no benefit really. And the question is, with the great progress we've made with the modern therapies, is there still a role for chemotherapy? There are certain subgroups of patients who do less well with immunotherapy and targeted therapies, specifically the uveal melanomas, so the eye melanomas. They don't respond to immunotherapy, they don't respond to targeted therapy, but unfortunately they don't respond to chemotherapy either, so it doesn't really have a role there. Another subgroup are patients with mucosal melanoma who do respond to immunotherapy, but only about 50% as well as if you had a skin melanoma. And there are a small group of those who respond to targeted therapy, and some of those might get a benefit from chemotherapy. So it was trying to identify, is there a subgroup? And I think there are some patients for whom it would still be relevant, and I tried to show who those would be. And then I talked a little bit about, where do we go from here with chemotherapy? We can apply the same discovery techniques that we have for the modern treatments, so molecular profiling, etc. But really, we don't have effective drugs, and unless we make a big step forward in chemotherapy drugs, or unless we identify some targets specific targets that respond, then I think we're very unlikely to make the same sort of progress with chemotherapy than we have with the other treatments. So it wasn't a very positive outcome really. Specifically with chemotherapy, I think that that has little role to play. If you're looking at the competition on the field, it really is still on the substitutes bench really. If you're looking at the good treatments that we have in melanoma, targeted therapy or immunotherapy, we've had a lot of debate about that, how to use those, how best to use them either in combination or in sequence. I think that's unresolved at present, still the subject of trials, but actually that's a difficult issue because it's a live question, and we have to address this to patients every day, but we don't have the data to advise them by. There's been a lot here about there's been a lot at this particular conference, as there is at all melanoma conferences, about side effects with immunotherapy versus benefit. And I think an interesting picture that's coming out is that the patients who get more toxicity seem to do better. Now that might be intuitive because the side effects are due to the immune system being activated, and it might be that that's a surrogate for more activity, but that seems to be coming out, and an interesting sort of way, interesting as a clinician, and also to be able to reassure patients that if you have to stop treatment early because of side effects, you're not necessarily compromising their outcome. Many of the treatments we're giving now are becoming chronic treatments, and so treating patients for 1 or 2 years, it's a major undertaking, both for hospitals, in terms of resource, but also for patients, the commitment to coming. Whereas that short, sharp shock, patients will often say, I'm happy to commit to 3 months of intensive treatment and deal with all the problems up front. And in terms of cost effectiveness as well, in fact, it might be a cost effective way to treat people, that they have more side effects up front, but you're giving less treatment in total. Yeah, so hyperfractionation it's obviously proven in some I'm not a radiotherapist, but it's proven in some tumour areas, and we had a big study recently in small cell lung cancer looking at hyperfractionation, which didn't show an improved outcome actually.